Hello, my name's Dr. Sean McCorkle. I'm owner and one of the veterinarians here at Summer Creek Animal Clinic. We started in November of 2018, and we wanted to make a video to show you around our clinic so you can learn a little bit more about us if you are interested in a position here at Summer Creek Animal Clinic. We're going to go ahead and head inside. Okay, this is the lobby of our hospital, and given the limited space we have here, we've had to come up with a creative way to separate the lobby as much as possible for dogs and for cats. And so this part of the lobby here with this entrance is the dog entrance, and then we have space for clients to sit as they wait, which is not very frequent. We try to get people into the exam rooms as quick as possible. And then around here, we have the cat entrance of the lobby with our cat exam room over here, so that hopefully that when they come in, they can head straight in to the cat room. And if not, we've got a little cat parking space here where we'll put a feel-away towel over them to help minimize that stress. And just helping the interaction between our team and the clients and the patients, we went with these pedestals. You can see Sam here, one of our awesome client care representatives. When somebody comes in, she's able to easily get up and interact with them and interact with the patient. And then here, this is one of our fear-free tools as well. We've had the scales built into the ground so that they're nice and flush. So it makes it a little bit easier for patients to get on the scale. It's a little less scary. So let's go ahead and start in our first exam room here. We primarily use this for cats. So we have a pedestal for the cats, we've got a perch for the cats, and we use feel-away in the exam room down here in the diffuser. We have, as of late, had to convert this into a small dog room as well, just with the space limitations and amount of growth we've had, but we've got a process in place to flip that and get pheromones in place, and then we move this into the corner and then bring this little ottoman out here for the small dogs. Back here into the back of the hospital, as well as through our food closet. And we transition to our exam room number 2, but these are strictly for dogs. We don't have any exam room tables at this point. It's worked out quite nicely just to have an ottoman. Or for bigger dogs, we just do the exam on the floor where they're a little bit more comfortable. Special exam room, room 4, which is our largest, and we also use this for our bereavement room. And so the unique thing about this exam room, and really what we wanted, was an entrance into the room directly from the outside of the building. And so a really high FAS or fear, anxiety, and stress pet can come straight into the exam room and eliminate the lobby altogether. We also see a lot of behavior cases here. One of our associate doctors is a behavior expert and is currently going through a behavior residency. And so we see behavior consultation cases. We even have a tether here in the wall to safely confine those pets while we're doing the consultation with the client. So we use this room for behavior cases as well. Into the back of the hospital. So this is our makeshift tech station. This was not originally what it was built to be, but again, as we grew so fast, we needed space for the technicians to work. This is Jason, one of our awesome technicians. The doctors each have 2 room technicians throughout the day. And so Dr. Torrance is actually in with one of the other technicians, and then Jason's in between rooms right now, so he's working on getting his records complete, putting in follow-up communications. He'll get the next exam room as they come in. And then this is our cat room that, to deal with the space we have, we really wanted something that was as fear-free as possible. So these are our cat condos that have these little pull-outs. So there's a hole there, so we can make these as wide as we want. So we can have a cat that can access the entire top, or we can close that and close it off. So usually when we have a cat in here, this is a surgical cat getting a dental today. We have this one open, so you can flip it around however you want. So when this one's all the way in, it is open. And then we've actually got a towel over the cat with feel-away on it to hopefully help provide some relaxation. And then if need be, we don't use this super often, but like to place catheters and stuff, we have a little makeshift table in here to bring the cats out on. So now we're at the back of the exam rooms. Exam room 2 and 3 empty into the pharmacy. We have our fridge, and then we actually use Cubex for most of our inventory. This is basically an inventory management system. So the team has fingerprints or a username password. Stuff gets entered into EasyVet, which is our practice management software, into the exam room. And then the technicians have veterinary assistants. And those veterinary assistants are back here after stuff's been put into the record. Then they can log in, put in the patient name, and then everything, the vaccines, the various medications are in here, and then they dispense them. So it helps organize everything and keep our inventory under control. And then it actually connects with this, so the fridge only unlocks whenever you dispense it to help us control it. We have our RX refill station, treats. We use lots of treats. We usually are wearing treat pouches. We fill it up, and that we take that into the exam room. So that one of the biggest things we do with Fear Free is we give lots of food and treats to these pets. It makes them a lot more comfortable. And then again, you can see coming into the back of exam room 1 into the food hall. So that also dumps into the pharmacy. And then this is our office. Again, very tight space. Started with just 2 of us in here, and now there's usually 4 or 5 people. This is one of our associate doctors, Dr. Torrance. He's in between seeing cases right now. He's in rooms today. I'm in surgery, which we're about to see. Now we're going to head into the back of the hospital where all the action is, into the treatment area. This is where we keep our controlled drugs. This is also Cubex, and so it has the fingerprint on here and has extra measures of security being the controlled drugs. And then that flows into another station as well as all of our lab equipment. This is my beautiful wife and practice manager, Jessica. We have a ultrasound unit from Oncura that is really, really nice because it allows us to have a certified ultrasound technician log in and help us through doing abdominal ultrasounds as well as full echocardiograms. So we actually do full heart workups here at the hospital. We gather all of the data, the most complicated one being the echo. And so there's always a technician that walks us through the entire process of getting all the good images. And then we send all of that data to Oncura, who has board certified cardiologists who read all of that information, give us the diagnosis, as well as treatment recommendations, follow-up recommendations. It's really, really good. And then we have all of the nice dental equipment, high-speed drills, dental x-rays. We're about to do a dental on a cat, so we've got all this set up with our handheld dental x-ray unit, all of the monitoring equipment and anesthesia that you would have in any standard AHA hospital. And then we have our treatment area, or our kennel area. They're pretty much our surgical pets. The one you can hear barking in there is going to be one of the ones that goes first, just because he's a little bit higher FAS. So we organize our surgeries not just based on what's most efficient, but what's best for the patients and their anxiety levels. And now we go to the back half of the treatment area, where we have another wet table. And then we can go ahead and go into surgery. Actually, real quick, this is another tech station. Again, with the growth we've had to come up with extra space for the techs to work. And so these are some of our surgical techs, surgical assistants. Head into the surgical suite. So we do a decent amount of surgery here. We're trying to grow and expand that. And as of the beginning of this year, we've incorporated laparoscopic and endoscopic procedures. And so today we actually get the opportunity to use the laparoscopic machine, which comes with this really nice TV screen. And I'm going to be the one doing the procedure in a minute. And we have equipment that goes through little portholes that allows us to visualize things really well and do the procedure with 65% less pain and space and much quicker recovery. And so it's really, really nice. We're going to get into that here in just a minute. So this is pretty straightforward surgical suite. It's really important to us to have a space for the team. So we did prioritize making sure we had a break room as big as we possibly could make it in this space. Yeah, that's the break room. our radiology room. We have top of the line DR, X-ray table, and unit. And that is our hospital at Summer Creek Animal Clinic. So I want to take a moment just to talk about our mission statement and core values and a little bit about what we're trying to do here as a team. So our mission statement at Summer Creek Animal Clinic is to provide a fear-free experience with compassionate and excellent client service and patient care. So everything we've done from the ground up is centered around that mission statement. And our core values are first, love people, love pets. So my wife and I started this hospital, and as Christians, it was really important for us to focus on caring for the people that are always attached with their pets. And second is fear-free first. So when we built this hospital, that was one of the driving factors for us to do this from the ground up, and centered around this idea of putting the comfort and emotional well-being of the pet as a priority. And thirdly, practice excellence and efficiency. Everything that we do, medicine-wise, flow of the hospital, all of those things, we want to take it through the lens of, is this practicing excellence, and is it the most efficient thing that we can do without compromising the excellence component. And the next is embody honesty and integrity. As a team, as a people here, we always want to have the most integrity we can. If we make a mistake, which we do, we always own that mistake. So we're not going to hide anything from clients. We're not going to do anything that's behind people's backs that's not being honest and holding up that integrity. And then value education is our next core value, and that's both for the clients. We're very heavy on being really thorough in the exam room, explaining things and thinking through all the different aspects of each case, and providing as much education as we can, as well as really trying to focus on educating the team. And this is certainly an area that we desire to continue to grow. Lastly, the core value that I often struggle with the most, which is have fun. It's easy to get so focused on trying to do things well that we forget to have fun, and we are very focused on trying to do that in the midst of all of these other things. And so we really much as a team desire to have fun together. And lastly, the last thing I'll say as a team culture, we really, me particularly and my wife as the owners, have always desired to have a strong positive culture and to care for the people that are here on our team. And so we're always trying to get feedback on how we can do things better to support the team. We would love for anybody that's interested in being on our team, being able to come in and help create that positive culture and help us to move forward. We just walked you through this hospital, and you can see that we're clearly starting to run out of space. And so actually right across the street, we have recently purchased some land. And so in the next couple of years, we're going to have a bigger space that is our own, that we're going to do our best to even take the fear-free model that we're trying to accomplish and be able to expand that into a bigger hospital. So we hope that you are interested in our clinic, and please click the link below to apply, and we would love to chat with you more. Feel free to reach out if you have any questions. Thank you so much.